Did you know that many seniors blame symptoms like swollen ankles, fatigue, dizziness, or even a persistent cough on simply getting older? When in some cases, these changes may be connected to how their bodies respond to blood pressure medications. It's something doctors see all the time, and unfortunately, many people ignore these signs because they assume they're just a normal part of aging. Now, I want to be clear. Medications like Amlodipine, Losartan, and Lisinopril have helped millions of people manage high blood pressure and protect their hearts. These medicines can be life-saving, and for most people, they are both safe and effective. But like any medication, they can affect the body in different ways, especially as we get older. Have you ever noticed that your shoes seem tighter by the evening? Or perhaps you felt more tired than usual, experienced occasional dizziness when standing up, or developed a cough that just doesn't seem to go away. Maybe you've had muscle cramps, changes in urination, or simply felt that something doesn't feel quite right. These are changes that many seniors overlook, yet doctors often encourage patients to pay attention to them. The good news is that noticing these changes doesn't mean something serious is wrong. In many cases, simple adjustments, healthy habits, and open communication with your healthcare provider can make a tremendous difference. Understanding what your body is telling you is one of the most important steps you can take to protect your health and maintain your independence. In today's video, we'll talk about why these medications are prescribed, the physical changes you should never ignore, and some of the everyday habits that may help support your overall health while taking them. We'll also discuss hydration, certain nutrients, common mistakes many seniors make, and when it's important to reach out to your doctor. Some of what you'll learn today may surprise you. In fact, one symptom that thousands of seniors dismiss every day is something doctors often wish patients would mention sooner. So, if you're taking Amlodipine, Losartan, or Lisinopril, or know someone who is, stay with me. Because understanding these changes could help you stay healthier, safer, and more confident in managing your blood pressure for years to come. High blood pressure is often called the silent condition, because many people don't feel any symptoms until serious problems develop. That's one reason doctors prescribe medications like Amlodipine, Losartan, and Lisinopril. These medications have helped millions of people around the world manage their blood pressure and reduce the risk of heart attacks, strokes, and other complications. For many seniors, they are an important part of maintaining health and independence. You see, when blood pressure remains too high for too long, it places extra strain on the heart and blood vessels. Over time, this can affect important organs, including the kidneys and even the brain. That's why controlling blood pressure isn't just about numbers on a machine. It's about protecting the body from damage that may develop slowly over many years. Although these medications work in different ways, they all have the same goal: helping blood flow more easily and reducing the workload on the heart. Some medications help relax blood vessels, while others affect certain hormones involved in blood pressure regulation. The result is healthier circulation and less stress on vital organs. What many seniors may not realize is that these medicines are often intended to be taken consistently and exactly as prescribed. Stopping them suddenly or changing the dose without medical guidance can sometimes cause blood pressure to rise again or create unnecessary risks. Even if you feel perfectly fine, it's important to remember that the medication is often doing its job quietly behind the scenes. That's why doctors always encourage patients to talk with their healthcare providers before making any changes. In many cases, if side effects or concerns arise, adjustments can be made safely. But those decisions should always be made together with a qualified healthcare professional. One challenge that becomes more common with age is that normal aging and medication effects can sometimes look very similar. For example, Many people assume that feeling tired more easily, becoming slightly dizzy when standing up, or noticing swelling around the ankles are simply signs of getting older. Others may blame muscle weakness, changes in urination, or occasional lightheadedness on age alone. And that's understandable. After all, our bodies naturally change over time. Blood vessels become less flexible, muscles may lose strength, and recovery can take longer than it once did. Because of this, it can sometimes be difficult to tell whether a new symptom is related to aging, daily habits, dehydration, or how the body is responding to medication. Another reason these changes are easy to miss is because they often appear gradually. You may not notice them from one day to the next. Instead, they can slowly become part of your routine. Perhaps you find yourself avoiding stairs because your legs feel heavier than before. Maybe you notice your shoes fitting tighter in the evening, or you feel more tired after activities that used to seem easy. These subtle changes can easily be dismissed as just getting older. But paying attention to your body doesn't mean becoming fearful. In fact, it's one of the most important things you can do to protect your health. Doctors don't expect patients to diagnose themselves, but they do encourage them to notice patterns and communicate any unusual changes. And some of these changes are surprisingly common. One symptom in particular affects many seniors taking certain blood pressure medications. Yet thousands of people never mention it because they don't realize it could be important. Another change often appears so gradually that family members notice it before the person experiencing it does. That's why, in the next part, we'll talk about some of the physical changes seniors should never ignore while taking amlodipine, Losartan, or Lisinopril, and why recognizing them early can help you and your doctor make the best decisions for your long-term health. One of the most important things I tell my patients is that paying attention to your body doesn't mean worrying about every little ache or pain. But it does mean noticing changes that are new, unusual, or gradually becoming more noticeable over time. And while medications like amlodipine, Losartan, and Lisinopril help millions of people manage their blood pressure safely, some seniors may experience physical changes that deserve attention and should never be ignored. Now, it's important to remember that not everyone experiences these symptoms. In fact, many people take these medications for years without any significant problems. But because everyone's body responds differently, doctors encourage patients to be aware of certain changes and discuss them if they occur. One of the most common things some people notice is swelling around the ankles or feet. You may find that your shoes fit comfortably in the morning, but feel tighter by evening. Socks may leave deeper marks around the ankles, or your feet may appear puffier than usual. This type of swelling is especially common with medications like amlodipine and often develops gradually, making it easy to overlook. Another symptom that sometimes catches people by surprise is dizziness or feeling lightheaded, especially when standing up too quickly. Have you ever gotten out of bed or risen from a chair and suddenly felt unsteady for a moment? This can happen because blood pressure medications are designed to lower pressure, and occasionally the body needs a little extra time to adjust when changing positions. That's one reason doctors often recommend standing up slowly and taking a moment before walking, particularly first thing in the morning. Something as simple as sitting on the edge of the bed for a few seconds before standing can help prevent unnecessary falls. Fatigue is another change that many seniors simply attribute to aging. They may say, "I'm just getting older," or "I don't have the energy I used to." While aging certainly plays a role, persistent tiredness shouldn't automatically be dismissed. If everyday activities suddenly feel more exhausting than usual, or if you find yourself needing frequent naps despite sleeping well, it's worth mentioning to your healthcare provider. A dry cough is another symptom that deserves attention, especially among people taking lisinopril. This cough often isn't related to a cold or infection. Instead, it may appear as a constant tickle in the throat or a cough that lingers for weeks without a clear explanation. Many people spend months treating allergies or assuming it's seasonal irritation without realizing their medication could be playing a role. Muscle weakness or unusual cramps can also occur. Some seniors notice that climbing stairs feels harder than before, or they feel less steady while walking. Others experience leg cramps or generalized weakness that seems out of proportion to their activity level. These symptoms can have many causes, including dehydration or changes in mineral balance, which is why doctors encourage patients to mention them rather than simply accepting them as normal. Changes in urination are another area that should not be ignored. You may notice you're urinating more or less than usual, waking up frequently during the night, or seeing changes that don't seem typical for you. Because blood pressure medications and kidney function are closely connected, doctors often monitor these changes carefully to make sure everything is working properly. Some people also describe feeling unusually lightheaded or mentally foggy. They may have trouble concentrating, feel less energetic, or simply sense that something feels different. These subtle changes often develop slowly, which is why keeping track of them can be so valuable. A simple notebook or even a note on your phone can be surprisingly helpful. Writing down when symptoms occur, how often they happen, and whether they are getting better or worse gives your doctor important information. For example, if ankle swelling always appears in the evening or dizziness occurs only after taking medication, those patterns may provide useful clues. The encouraging news is that noticing these symptoms doesn't mean you should stop your medication or panic. In many cases, adjustments in dosage, timing, hydration, or other lifestyle factors can make a tremendous difference. The goal isn't to become anxious, it's to become informed. And speaking of hydration and lifestyle, there's another factor many seniors overlook entirely. Certain daily habits, medications, and even dehydration can influence how these blood pressure medicines work inside the body. In fact, one very common mistake may quietly increase the risk of dizziness, fatigue, and muscle weakness without people ever realizing it. That's exactly what we'll explore next. One thing that often surprises seniors is how much everyday habits can influence the way blood pressure medications work. Medicines like Amlodipine, Losartan, and Lisinopril are designed to help control blood pressure and protect important organs, but they work best when the body has the support it needs. And that includes staying hydrated, maintaining healthy kidney function, and paying attention to things that may quietly interfere with treatment. Let's start with hydration, because it's one of the most overlooked factors. As we age, the sensation of thirst often becomes less noticeable. In other words, many seniors simply don't feel thirsty as often, even when their bodies need more fluids. Add warm weather, physical activity, or certain medications to the mix, and dehydration can happen more easily than many people realize. When the body doesn't have enough fluids, blood pressure may become harder to regulate. Some people begin experiencing dizziness, fatigue, muscle cramps, or feelings of weakness and assume it's just part of getting older. But in some cases, dehydration may be contributing to those symptoms. That's why doctors frequently encourage seniors to drink water consistently throughout the day, instead of waiting until they feel thirsty. Kidney health is another important part of the picture. Your kidneys act like natural filters, helping regulate fluid balance and remove waste products from the body. Blood pressure medications and kidney function are closely connected, which is why doctors often monitor blood tests from time to time. Healthy kidneys help these medications do their job effectively, while changes in kidney function may affect how the body handles them. Another topic that deserves attention is potassium. Potassium is an important mineral that helps muscles, nerves, and the heart function properly. But maintaining the right balance is important. Some blood pressure medications may affect potassium levels, and this is one reason doctors sometimes order blood tests and discuss diet with their patients. This doesn't mean people should suddenly load up on potassium supplements or dramatically change their diet without guidance. In fact, balance is the key. That's why healthcare providers often individualize recommendations based on each person's medical history and medications. Salt intake is another area where simple habits can make a big difference. Many processed foods contain far more sodium than people realize. Canned soups, frozen dinners, deli meats, packaged snacks, and restaurant meals can add up quickly. Excess salt may make blood pressure harder to control and can contribute to fluid retention, causing swelling and discomfort in some individuals. What's interesting is that many seniors don't realize where most of their sodium is coming from. They may avoid using the salt shaker at the table, but unknowingly consume large amounts through packaged foods. Reading labels and choosing fresh ingredients whenever possible can help support overall health. Another common mistake involves over-the-counter medications. Many people reach for pain relievers, cold medicines, or decongestants without thinking twice. But some of these products can affect blood pressure or interact with medications. Certain anti-inflammatory pain relievers, for example, may influence kidney function or interfere with blood pressure control. That's why doctors often recommend checking with a pharmacist or healthcare provider before starting new medications, even if they don't require a prescription. I've also seen many seniors assume that symptoms such as fatigue, swollen ankles, or dizziness are simply old age. Because these changes often develop gradually, people adapt to them without realizing something may need attention. They begin avoiding walks because they feel weak, or they rise slowly because they expect dizziness every morning. Over time, these symptoms become accepted as normal when they may actually deserve a conversation with a healthcare provider. Another mistake is skipping meals or relying heavily on processed convenience foods. Busy schedules, living alone, or decreased appetite can make it tempting to choose whatever is easiest. But the body still needs proper nourishment to support energy, circulation, and overall well-being. The encouraging news is that medications are only one part of the picture. Daily habits, food choices, sleep, and physical activity all work together to support long-term health. And some of the simplest lifestyle changes can complement these medications in ways many people never expect. In fact, certain foods, regular movement, quality sleep, and stress management may help support heart health and overall wellness while working alongside prescribed medications, not replacing them. And some of these habits are surprisingly easy to incorporate into everyday life. That's exactly what we'll explore next. One of the most encouraging things I tell my patients is that medications don't have to do all the work alone. In fact, some of the most powerful ways to support healthy blood pressure involve simple daily habits that work together with medications, not in place of them. Think of medications like Amlodipine, Losartan, and Lisinopril as one part of the picture, while healthy eating, Physical activity, quality sleep, and stress management provide additional support for your heart and blood vessels. Let's begin with food, because what you eat every day has a tremendous influence on your overall health. Your body depends on nutrients to support circulation, maintain healthy blood vessels, and provide steady energy. Fortunately, you don't need complicated diets or expensive supplements to achieve this. Colorful fruits and vegetables are among the best places to start. Foods like berries, oranges, spinach, broccoli, carrots, and sweet potatoes provide vitamins, minerals, and antioxidants that support overall wellness. These nutrients help protect cells from damage and contribute to healthy circulation. Adding more color to your plate is one of the simplest ways to improve nutrition. Lean proteins are equally important. Fish, chicken, beans, eggs, and Greek yogurt provide the building blocks your body needs for muscle strength and tissue repair. Fatty fish like salmon and sardines are especially valuable because they contain omega-3 fats that support heart health. Healthy fats deserve attention as well. Avocados, olive oil, almonds, walnuts, and seeds contain nutrients that help maintain healthy blood vessels. A simple salad with olive oil dressing, a handful of nuts as a snack, or avocado slices with lunch can provide these benefits without requiring major changes to your routine. Whole grains such as oats, brown rice, quinoa, and whole grain bread provide fiber, which supports digestion and contributes to a healthy lifestyle. Small changes like replacing white bread with whole grain options or choosing oatmeal instead of sugary cereals can add up over time. Physical activity is another habit that works hand in hand with blood pressure medications. Now, this doesn't mean you need to spend hours in the gym. Even moderate activity can make a meaningful difference. A daily walk around the neighborhood, gentle stretching, gardening, swimming, or light exercises can help support circulation and maintain muscle strength. Many seniors are surprised to learn that movement doesn't have to be intense to be beneficial. Something as simple as standing up regularly during the day, walking after meals, or taking the stairs when possible can support heart health and improve energy levels. Sleep is another area that often gets overlooked. During sleep, the body performs important repair processes. Poor sleep may contribute to stress and make blood pressure harder to manage. Creating a consistent bedtime routine, limiting caffeine late in the day, and keeping the bedroom comfortable and quiet can help improve sleep quality. Stress management is equally important. Life brings challenges at every age, and ongoing stress may affect both the mind and body. Relaxation techniques such as deep breathing, prayer, meditation, reading, listening to music, or spending time with loved ones can help create a sense of calm and support emotional well-being. Another helpful habit is consistency. Taking medications at the same time each day, eating balanced meals, staying active, and attending regular medical appointments all work together to support long-term health. These routines may seem simple, but over time, they can have a powerful impact. Most importantly, healthy habits are meant to complement medications, not replace them. Some people make the mistake of feeling better and deciding they no longer need treatment, but blood pressure often rises silently without obvious symptoms. That's why doctors emphasize combining medication with healthy lifestyle choices rather than choosing one or the other. The encouraging news is that small improvements practiced consistently can make a remarkable difference. But there are also certain symptoms that should never be ignored, and while most side effects are mild or manageable, Some warning signs deserve prompt medical attention. Knowing the difference can help seniors stay safe and confident while managing their blood pressure. That's exactly what we'll explore next.